So welcome. You're going to get a lot of information today, and I'm happy to stay as long as you want me to answer questions or whatever. There's a lot of misinformation out there about cataracts and cataract surgery, and we're going to try to steer you through all those different paths and so you know what you need to know. So basically, cataract surgery has changed over the last several years. And years ago, you had to go in the hospital, you were sandbagged for 2 weeks, couldn't move, couldn't do this, and you waited till the cataract pool got right, which really that was not the correct term because you really didn't wait that long, though I did do a right cataract today, which we don't do a lot of, and so we'll go over all that. But today, it's an outpatient, the surgery is about 10 minutes long. The next day you can go play golf and sort of do what you want to do, so it's totally different than what it used to be. So the goals have changed. So now the goal is, and I have trademarked precision cataract surgery. So now our goal is to give you, not just take the cataract out, but to provide you the best possible vision with the least dependency on glasses, if that's what you choose to do. So we're not just trying to get the cataract out. That's done very well anymore. We're trying to also maximize the quality of your vision. So, what is a cataract? I bet everybody here thinks it's a growth growing over their eye. Everybody think that it's a film growing over your eye? Not true. I bet everybody thinks that. So that's one myth that we're going to get rid of today. So your eye works exactly like a camera. So if you have a lens, then the lens focuses the image onto the film of the camera, and that's how the camera works. So basically, in your human eye, there's a cornea, which does focusing, and then there's a lens behind your pupil that these two things focus light to the macula, which is all where clear vision is located, onto your retina. And so that an eye and a camera work exactly the same. So what is a cataract? So a cataract is this lens behind your pupil becomes cloudy. It's not a growth. It's not growing. It's not doing anything. This is clouding up. So it would be similar to the windshield on your car is fogging up. There's not something growing over your windshield. It's your windshield is fogging up. So the cloudier this lens gets, the more blurred your vision gets. And so what are the symptoms of cataracts? Bright colors is not really a great symptom that I could tell you about because the cataracts in most cases take years to happen, so you really don't notice there's any difference in your colors, most likely. You won't know there's a difference in the colors till after the cataract surgery. You see the difference that's happening. But it does cause a change in colors. If you look at the paintings of Monet, when he was very young, his colors were sort of normal and there was nothing special other than he was a great painter. But when he lived to be in his 80s or 90s, when he got to be old, all his paintings became bright and brilliant because he didn't know he was painting that way. He had cataracts and he didn't know that he was painting the way he was painting as far as the colors were concerned. Things that are common is halos around light. So very common, one of the first symptoms people get with cataracts is that they have trouble driving at night. They have trouble seeing because things aren't as bright, and they have glare and halos and glare from headlights and lights. Also difficulty reading in low light, same thing. The cataract, that lens is not focusing clearly, so you need more light to see. So reading becomes trouble in low light. Obviously the vision is going to be blurred. Sometimes people see double. And as the cataracts change in a lot of people, it makes your eye more nearsighted. So just changing your glasses a lot of times is all that you need to have done with cataracts. As they're developing, you don't have to have surgery. I just gave a talk out in Lehigh last week, and a lady said, I was told I have to have cataract surgery. And that's not true, so we're going to go over that. And so who gets cataracts? So basically that clouding of your lens inside your eye is an aging change. And so as we age and get older, then the lens gets denser and more cloudy as time goes along. And typically the lens takes on a brown, yellowish color. That's the reason why colors have changed. So you're almost wearing brown colored sunglasses, except the sunglasses, your lens in your eye. But I do operate on people who are younger, and I have operated on a 2-month-old. So you can be born with cataracts, but those are very rare, not very common. So basically, this is sort of an aging process, and what can make this happen a little worse? So we know that UV light makes cataracts develop at a faster rate. So over years of time, if you're out in the sun all the time, you wear no sunglasses, no hat, or anything, then you're going to get cataracts on an average at a younger age than someone who does. They did a study many years ago on commercial fishermen at Chesapeake Bay, and the commercial fishermen who wore no hat or no sunglasses got cataracts on an average at a younger age than fishermen who wore a hat and or sunglasses. So it is important to wear sunglasses, though if you're already 60 years of that wearing them, it's probably a little late to start, but it still doesn't hurt. And so what are the treatments? So what I told you about the lady saying she had to have it done is incorrect. The most common treatment is just watching till the cataracts get worse. Also, we can change the glasses. And then the last choice is taking the cataract out. And so I get asked all the time, every day in my office, well, when should I do it, or what should I do? I've been told, or I've had second opinions where I've been told I have to do it. And so when should you have cataract surgery? That's individual for every person in you, and what their lifestyle is and what they do. If I got cataracts and I'm still doing this job, you would want me to have cataract surgery very early on if I'm doing your surgery. So if I'm still doing this and I get cataracts, I'm not going to wait very long to get them done. If I'm retired and I can still play tennis or golf or do my computer work and do whatever I want to do and I'm still doing okay, then I would wait till it got worse. And then at some point when I had trouble doing those things, then that's when I would decide to do it. Unfortunately, it happens all over the country, but really badly here, is that doctors tell people they must do it, have to do it. If we don't do it now, the complications will be more later. This is an emergency, semi-emergency problem, and you have to do this now. The only reason they're telling people that is because they want a bigger car. Okay, it's not true. If I did your surgery today, or I do it a year from now, the results and your success rate is going to be identical. So it doesn't matter, medically speaking, when it's done. Now, we did do a lady today that has a right or hypermature cataract. So what is a right cataract? A right cataract is when your pupil turns pure white. So anyone could see that that person had a cataract. So that no one really, except this lady, she's 90 years old, she was afraid that she didn't go to doctors, and she just let it go until it got that bad. But those are not common. So, and that is a right cataract. So even 30 years ago, no one waited till they got that bad. But it was just a convenient term that doctors used to say, well, your cataract's white, but now we're going to do it. A right cataract is your pupil is white. And if you let it go that long, it really, at that point, it is more difficult to do the surgery. Still can be done. Still can get great results, but it is a little more risky to do it at that point. So, if all we do is talk about the cataracts, then we're not going to correct all your vision. So everyone in their 40s gets presbyopia. So presbyopia is the inability of your lens to focus from distance to near. So everyone, that happens to everyone's lens. The lens in your eye loses its ability to focus, and that happens to everybody. Now, if you're nearsighted, you can take your glasses off and read. But if you're not nearsighted, then you're going to have reading glasses, or you're going to have, if you're farsighted, you need glasses for distance and reading, so you're in a bifocal. So then there's different kinds of lenses. And 7 or 8 years ago, there was one kind of lens. Today, we got multiple kind of lenses. So in our precision cataract surgery brochure has a bunch of different options in that on how you choose to correct your vision. So if the most common lens, and the first lens was put in an eye in England in 1949, and how that came about was eye doctors in England and London were taking care of airmen who were flying bombing missions over Germany, and they would come back with their plane shut up, and the glass, or actually plexiglass, would be shattered into their face, and they would have these particles that would have penetrated their eye. But once, if the eye was sewn up and that part was okay, the little particle in their eye didn't bother their eye. That is, they didn't get a reaction. Their body didn't try to reject that material. It was sort of inert. So therefore, they decided, well, maybe we can make a lens out of that since the eye doesn't mind it being there. And so that's how the first intraocular lens came about. So since that time, the lenses have gotten better and better and more designs, and the size and shape and how they're made has gotten just a lot further along. Now, that lens was one power. So if we put a lens in your eye and then we do a lot of different measures, and that's part of precision cataract surgery, is we just don't do a little measuring, we do a lot of measuring, a lot of talking about what your options are. And so knowing more about your eye then lets us pick a better lens for your eye. A single lens is going to give you one distance. If you have astigmatism and you have this plain regular lens, you're still going to be blurred because it didn't correct the astigmatism. So if you want to see clearly at distance without glasses, you would have to have the astigmatism corrected if you have that, and a plain simple lens will not accomplish that. So we have astigmatism lenses, we have a regular lens that's been around forever, we have sort of a high definition lens. So a high definition lens is your cornea is not round, sort of like the picture showed, like a basketball. Or if you have astigmatism, your cornea is shaped like a football. So a regular implant that's been around for many, many, many years is a rounded lens, just like your glasses are a rounded lens. We now have your cornea is shaped where it's deeper in the middle and flatter in the periphery. So your cornea is aspheric, not spherical. So now we have lenses that have been designed to be aspherical. So now the lenses are steeper and more powerful in the middle and less in the periphery. So it more matches your eye, so you get a little crisper, sharper, more contrast in your vision with that type of lens. It's sort of like going from a regular TV to a high definition TV. You can still see the football game on the regular TV, it's just a little nicer on the flat screen, big screen, high definition TV. So that's the difference in those kind of lenses. And then the last type is called a restore lens. So a restore lens is a lens that has a bifocal in it. And you can't see that on the lens very well, but you can see on the picture behind. So there's rings in this lens. So these lenses are called diffractive lenses. So a diffractive lens splits the image that you're looking at. So your world has now two images in your eye. There's an image that is focused for distance, and there's an image that's focused for near. And so when you look at distance, then the only image you see clearly in your vision is the distance one. And when you look up close, whether it's up, down, right, or left, different than a bifocal in your glasses where you have to always look down, whether you look right or left, up or down, as long as it's near, then the only image that's clear in your eye or your vision is the near image. So that's how these lenses give you distance and reading, is they actually give you two images on your retina. And it just depends on where you're looking. They work really well, but they're not perfect. The disadvantage of this lens is that because of these rings, people do see rings and halos around lights at night with this lens. So out of the 7 years or so that we've been putting these lenses in, no one has come back and said, I can't stand the rings, take the lens out, I don't like it for that reason. There's some people unhappy for other reasons, but not for the ring part. And so even though it's there, it's not a big problem, because now they're glasses free, so they're overall still happy, and your brain sort of gets used to how you see differently with this lens, and those complaints fade away over a few months at a time. And so the other thing that happens, because you now have two images, is that you need a little more light to read, because you now have two images that you're focusing versus one. So there is a little bit of contrast as far as that part goes. But 95% of people who have this lens see well, do well, and are very happy with how they do with this lens. So it does work very well. So the ability is that this gives you distance and reading as far as your vision goes. So people who have this, like I said, 94% of people, in my hands, better than 90% of people never put a pair of glasses on. There are some people, because it's 2 powers, that maybe in a few people the computer is not quite as sharp as they would like it, and sometimes they put on a little cheater glass for that distance as far as the Restore lens goes. And there's a couple of different brands. Restore is the one I use most of the time. There's a lens called Technis Multifocal, and then there's another lens that's called Crystal lens. The Crystal lens works differently. The Crystal lens is still 1 power, but it's shaped in a way that as your eye tries to focus, it moves a little bit inside your eye and changes the strength that way. That's probably the least used of all the different lenses that do distance and reading, because in my hands, it was pretty unpredictable who got some reading and who didn't in that kind of lens, because it didn't always move the way it was supposed to move. So what happens on cataract surgery day? So basically, you're going to go into the surgery center. You don't disrobe anymore, any of those kind of things. So you basically go into the surgery center. They will start an IV. There's no bottle attached to the IV. There's just an IV. So they can give you Valium kind of drugs to keep you calm and relaxed, and so you're comfortable through the procedure. You get a whole bunch of dilating drops and numbing drops prior to the surgery, so your pupil, because I said the lens is behind your pupil, so we got to get your pupil wide as we can so we can get to the lens. And then we just use numbing drops. There's no shots, no patches, no stitches. And so it's different than those days where you had a patch on your eye and people got black eyes and bruising because of the injections. I haven't really done any injections for routine cataract surgery in probably 15 years or longer, actually. And so I very quickly, when it started being sort of a different way to do it, I switched over just because I didn't like the needle part. So, and most patients didn't like it. So I've been doing topical for a long time. So that's that part, and I'm going to switch over now that this computer's turned on and show you a bunch of stuff about the laser part. So this